Good afternoon, and thank you for joining us for this community briefing on COVID-19 and our community's response. Joining me again is interpreter Margie Propp, and we've been very fortunate to have interpreters here for our briefings. In addition to Margie, we've had the pleasure of working with Sharon Sinkler and Francis Beauvirage. And I just want to take a minute to thank you and Sharon and Francis for all you're doing, and to wish you a happy National ASL Day, the annual holiday celebrating the annual American Sign Language. We really appreciate the work of Margie, Sharon, and Francis as we seek to reach all of our residents with important public health messages. We want to remind all of you that you can continue to find accurate, timely, and reliable information at our website, covid19.lincoln.ne.gov. Now moving on to our situation update for today. We've had 2 new cases of individuals diagnosed with COVID-19 here in Lincoln. The total number of people in Lincoln with lab-confirmed cases of COVID-19 is now at 59. The cases reported this morning are 2 men, one in his 20s and one in his 60s. And the health department has determined that both of these cases are community acquired. Yesterday, we reported that the total number of community-acquired cases was 40. That was later corrected to 39. So this means that today's 2 new community-acquired cases brings our total in Lincoln to 41. Here to provide more details on the health department's investigations into these cases is Interim Health Director Pat Lopez.
Good afternoon. As the mayor said today, we're reporting 2 new cases. They are both self-isolating and their close contacts are self-quarantined. We have 4 individuals in Lancaster County that are hospitalized at this time, and we have 2 that are currently on a ventilator. Nebraska now has 911 cases and 20 deaths. That includes the 1 death in Lincoln last week. With the additional cases today, Lancaster County is at about a 3.2% positivity rate, which is the number of positive cases compared to the total number of tests completed. The state remains at about 7.7%, and the national rate remains at about 16%. We know that COVID-19 is a dangerous virus, but thankfully most people with the virus have mild illness and are able to recover at home without medical care, which is really the case of what's happened in our community. As the number of positive cases continues to rise locally, we also anticipate seeing the number grow for those who have recovered. We have received questions about those who have recovered, including this one: what does recovery mean? As I said yesterday, due to the serious nature of the virus, the Centers for Disease Control and Prevention are being extremely careful when deciding what it means to recover from COVID-19, since it's such a new virus that we learn about daily. There are both medical and testing criteria a person must meet before being officially declared recovered. Medically, a person must be fever-free without fever-reducing medications, in other words, Tylenol, aspirin, ibuprofen, for 72 hours. They also must be at least full 7 days past when the symptoms began. In addition to those requirements, the CDC guidelines say that a person must test negative for the coronavirus twice, with the tests taken at least 24 hours apart. But with the limited number of tests, we are unable to complete additional negative tests for those who are recovering at home, which has been the case during the limitation. We are researching and talking with other health departments around the country to find a standard or criteria to track this data. The lack of testing is why most are not reporting numbers of those who have recovered. We hope this will change as we're able to do more testing. In fact, we know it will, because we'll have more information available to share. When it comes to those hospitalized with COVID-19, they must have 2 negative tests before being discharged. We are currently working with the hospitals to report this data.
Again today, we want to emphasize that more opportunities for testing are now available in Lincoln. The number of tests that can be performed on a daily basis locally has grown from 60 to 150. There is also a big improvement in the turnaround time for test results. It now only takes about 48 hours. Previously, during the initial stages of the pandemic, tests were limited to those who fell into certain prioritized groups. Testing is now available, however, to anyone who is showing symptoms of COVID-19, like a fever or cough or shortness of breath. At the drive-through testing sites yesterday, only 63 tests were performed, and that's only 42% of our new expanded capacity here in our community. And that's why we're strongly encouraging folks with symptoms to access the free online services offered by Bryan Health and CHI Health. And to begin that process, all you need to do is to fill out a simple online questionnaire at chihealth.com or bryanhealth.com. And if testing is recommended, individuals will be given an order and referred to one of the drive-through testing sites. Currently, those are at North Star High School and at Bryan Health's LifePoint facilities. The drive-through sites will accept those who have received either a doctor's order or referrals from Bryan Health or CHI Health St. Elizabeth or our health department. And it will also so that is how you can, again, access our increased and expanded testing capacity here in Lincoln. Today, we are going to focus a chunk of our briefing on a really important topic, and that's visiting your medical provider safely. Today, we're here to share valuable information about how you can safely access medical care during this public health emergency. Joining me in just a moment to talk about this is Lincoln City Councilmember Roy Christensen. Councilman Christensen is a professional audiologist and owner of Christensen Hearing Analytics. But before we begin this topic, I just want to acknowledge and appreciate the courage, sacrifice, and dedication of all of our medical care professionals here in our community as they provide care during the COVID-19 pandemic. We are so grateful for your sacrifice and selfless service to take care of all Lincoln residents. This pandemic is disrupting our daily lives in myriad ways, and one of the largest impacts is, of course, on our healthcare systems. We see those impacts across the nation as teams from hospitals and emergency centers in other states work around the clock to outfit convention centers with hospital beds or stand up tents in parks in order to grow their capacity to accommodate a surge in sick and critically ill patients. We see local healthcare impacts as well, as our Lincoln and Lancaster County hospitals and emergency centers have set up tents outdoors for the drive-through testing I was just talking about, or built out new rooms for patients with COVID-19, and coordinated in unprecedented ways to make their preparations to treat those who may become ill with COVID-19 locally. While these impacts to hospitals are increasingly widely known and recognized, significant impacts of the pandemic on other healthcare facilities we depend on for more routine care may be less known or understood. As we seek to access other medical care and services unrelated to COVID-19, many people may be wondering how and when they should address other important healthcare needs like routine medical checkups or dental work. Should they schedule periodic health screenings such as mammograms or colonoscopies? How do they handle an elective surgery? These are really important questions, and we appreciate residents taking the time to find the answers that will keep them safe and healthy, and that will help our healthcare system continue to perform well. And because of the pandemic, the U.S. Centers for Disease Control and Prevention recommends that healthcare facilities and clinicians should prioritize urgent and emergency visits and procedures. These actions can preserve personal protective equipment, or PPE, and patient care supplies, ensure staff and patient safety, and expand available hospital capacity. So the CDC recommends that medical providers reschedule elective and non-urgent admissions, delay inpatient and outpatient elective surgical and procedural cases, and postpone routine dental and eye care visits. These recommendations are important not only to keep our doctors' offices and hospitals from being overwhelmed, but also to help prevent someone who may be unknowingly carrying the virus from spreading it and exposing other patients and medical staff. The directed health measure ordered by Governor Ricketts last week prohibits elective medical or dental surgery or procedures unless determined to be needed immediately by the medical or dental provider to preserve the patient's life or health. The term elective can sometimes be confusing for the layperson. Johns Hopkins Medicine explains an elective surgery does not always mean it is optional. It simply means that the surgery can be scheduled in advance. It may be a surgery you can choose to have for a better quality of life, but not for a life-threatening condition. But in some cases, it may be for a serious condition, such as cancer. That's why the decisions about surgeries and procedures must be made in consultation with your medical professional using state and federal guidelines. And of course, if you don't have a medical care provider, you can always call our health department for guidance. That's at 402-441-8006. As with most things, communication is the key. Check the website of your medical care provider for information. Email or call the office to learn what options may be available. And many medical practices have been communicating with patients who do not need urgent care and seeing if they would be willing to forego their appointments this month. They are also working to address certain needs like prescription refills and medical guidance over the telephone. More and more medical practices are using telehealth, including online chat with live video conferencing tools to connect with patients. And these technologies are secure and private, and they meet all privacy law requirements. And you can just ask your healthcare provider if you can meet remotely. There are a lot of options out there that you can explore. And at this time, I'd like to invite City Councilman Roy Christensen to come up and talk a little bit more about what he's experiencing in his own practice and the steps he's taking to protect our residents. Thank you for being here.
Thank you, Mayor, and good afternoon, Lincoln. At my office, we have been working with patients to ensure we're able to safely serve their hearing needs during this crisis. All healthcare providers appreciate connecting with their patients to meet their needs. Healthcare offices across Lincoln have implemented additional office protocols to help keep both patients and staff members safe. At my office, these include telephone screenings to determine the urgency of the needed services, recent travel history, current state of health of the patient and household members. We schedule no more than one patient in our office at a time. Again, we screen a patient when they arrive at our office and practice social distancing to the extent possible. We practice rigorous disinfection protocols and heightened personal hygiene protocols to protect everyone. In addition, we are able to provide outside the office help like curbside service or house calls, and even with some of the newest hearing instruments, remote programming of hearing aids. So I can reprogram someone's hearing aids as they're at home connecting with me electronically. All healthcare providers are engaging in similar practices tailored to their situation and the needs of their patients. I want to tell you a quick story that just happened to me this week. A woman that I know came to me and said, I've got some things I need to do at my doctor, but I'm just reluctant and a little fearful to go do that. And we talked about it, and I said, well, it seems to me that these are pretty necessary things you ought to be doing. And she said, well, I'm kind of afraid because I think that's where I'll probably meet somebody who might transmit the COVID-19 because that's where sick people go, right, the doctors? And I said, well, how about you do this? Stop right now and call your doctor's office and see what they have to tell you. And so she did just that. And after a brief 5-minute conversation, she was convinced that she could go to her doctor and take care of the issues that needed to be taken care of and do it safely. And here's the nice part about it. You know how you usually have to wait a long time to get an appointment with your doctor? She was in the next day. And the issues were taken care of, and she was pleased to report back to me that she was in and out of that office fully taken care of within 15 minutes. So if you have questions or concerns, rely on facts and faith, not fear. Go ahead and make your call. Connect with your healthcare provider and make a decision with them that'll help you and your family. Ultimately, each of us is responsible for our own health care and that of our household. I encourage all of us to use our best judgment to protect each other so we can emerge as soon as is reasonably possible from this crisis. Right now is not the time to let up on our efforts. We should listen to Health Department Director Pat Lopez and our community health professionals. Let's not quit before we cross the finish line. even if we don't know where that finish line is right now. I know that medical providers are working hard across our community to adjust their protocols and practices to be able to continue to provide high-quality health services to our city and our citizens. Like the mayor, I want to thank those on the frontline medical personnel for their courage, flexibility, and hard work during this health emergency. It's been a real blessing for me to watch our community pull together during these tough times. Mayor?
Thank you, Councilman. I really appreciate the work that you and all our other healthcare providers in our community are doing and the adaptations that you're making to help keep our residents safe and healthy. Communicating, exploring options, and good planning between patients and medical staff are just so important when making decisions about keeping or rescheduling appointments and services. And the answers are not the same for everyone. A person's age, what the appointment may be for, what their personal physician recommends, and the local healthcare provider's caseload, of course, all factor into the decision. It's really a matter of weighing the risk taken in keeping the appointment against the benefit of that appointment. And I want to stress that the consideration to postpone medical treatment pertains only to routine or elective appointments. If you are newly ill or injured, call your doctor or the closest urgent care center or hospital and ask for their advice. And of course, for life-threatening conditions, call 911 immediately. By working together, we will continue to keep our healthcare systems running effectively and our residents safe, healthy, and cared for. Moving on to some other updates and good news, I want to just acknowledge that today is April 15th, and normally would be the deadline for filing income tax returns. However, because of the COVID-19 pandemic, that deadline has been extended to July 15th, 2020 for both federal and Nebraska state income tax returns. If you are in a position where you're able to file your returns now or before July 15th, we encourage you to do so to help ensure that the healthy cash flow is there that's needed to support state government services and the provision of public goods. If you're expecting a refund, you are encouraged to file before July 15th as well. More information can be found at www.irs.org. Lincoln's Volunteer Income Tax Assistant, or VITA, V-I-T-A program, is working to set up online tax help for clients with low incomes who used to access those services in person at libraries, at the Center for People in Need, and at the VA. While the deadline has been extended to July, VITA wants to get that help available out to folks sooner in order to get tax refunds to clients sooner. We will post updates on this as they become available. Next, we want to extend an invitation to all of you watching to a special event coming up this week. On Friday morning at 7:30 a.m., the Mayor's Interfaith Prayer Breakfast will be hosted virtually this year on Link TV, Facebook, YouTube, and web channels, as well as our local Link TV channels. The topic of the breakfast is building a compassionate community. And the event will feature blessings from a number of different faith traditions and remarks from guest speaker Nipun Mehta, who founded Service Space and who has been named one of the most inspiring people in the world for his work in developing a global volunteer ecosystem rooted in kindness and compassion. We hope you can join us as we consider how this moment of trial can afford us opportunities to transform ourselves and our city for the better. Again, we invite you to tune in on Friday at 7:30 a.m. for the Interfaith Prayer Breakfast. And finally today, we wish a happy new year to the 3,000 Yazidis who now make Lincoln home. Our local Yazda organization shared this information with us today about the holiday, the Yazidi New Year, known as Sharshama Sari Sali. This holiday marks a symbolic moment with the Yazidi faith, just as spring transforms the earth into its most lush and vivid state. The Yazidi New Year represents the renewal of both nature and hope, which is something I think we all really want to cling to right now. Given the unprecedented nature of the COVID-19 pandemic, instead of the traditional public gatherings for the New Year, Yazidi communities across the globe are committed to celebrating with their family members without leaving their homes, or in some cases, tents. To mark the occasion, Yazda's leadership, members, and volunteers send their most sincere wishes for safety and good health to everyone in the world, including all of us here in Lincoln. And with that, we'd be happy to open things up for questions. Okay, got a correction. The website we provided earlier with information about income tax filing dates and deadlines is irs.gov, not irs.org. My apologies. Okay, questions?
Riley from the Journal Star.
Riley?
Hi, everyone. I had a question. I think it's for Director Lopez. And I guess more or less on how does, what specific patients is the health department aware of that are hospitalized versus are there patients being treated as rule out COVID cases that aren't being reported to the health department? I think I was on the Brian briefing earlier and it sounds like they have 6 people in the ICU. And I just wanted to make sure I understood maybe some of those differing numbers there between the hospitalizations you reported and the numbers that Brian had given out earlier today.
Sure. I'm not sure if they had a change since early this morning when we talked to them, Riley. You know, things change sometimes hour by hour. But this morning they had 2 COVID positive patients on the vent, and we had a total of 4 COVID positive patients in the hospital. And then they probably are referring to some who they've done testing on, and those tests are pending.
But when the health department reports it, it's only those that are confirmed COVID-19 patients? Okay, thank you.
Correct. Even though we have some that are COVID pending, they may have tested them, but the tests come back negative. So it would be more confusing to go back then. It's just those that they look at, and we get that report every day, and we work with them on that and looking at our modeling. So we only report out the positive cases. And just like we only report the pending cases, the pending lab tests from the public health lab, because we don't have the full count of lab tests that went to other labs, but we do report those when we get the results back.
Diane, just a quick question. Are there patients, COVID patients at Lincoln hospitals who are from other communities?
Yes, there are. And so that's, that might also be, thanks Diane, that might also be what you're seeing. And so we keep those patient numbers separate. We know how many patients are from other counties that are COVID positive and which ones are from Lincoln only. You know, our health systems provide services to many areas outside of Lincoln, and so they're continuing to do that at this time.
Are there other questions today? All right. Well, thank you so much for tuning in. We appreciate you being here, and we'll see you tomorrow at 3:30.